Hello everyone. I am Dr. Lata, Assistant Professor in the Department of Mental Health Education and NABH Quality Manager at NIMHANS. So today we will be discussing on the topic occupational health and safety. Healthcare workers are at risk of getting infected because of the occupational exposure. The hospital employees can also transmit infections to patients and other employees. And the employees' health program must be in place to prevent and manage the infections among the hospital staff. And in this COVID 19 situation, all of us realize the actual importance of this occupational health and safety, where it is very critical for all of us to adhere to use of proper personal protective equipment. So the definition given by occupation about the occupational safety and health by the OSHA states that the anticipation, recognition, evaluation, and control of hazards arising in or from the workplace that could impair the health and well being of the workers, taking into account the possible impact on the surrounding communities and the general environment. It is very important for providing pre exposure prophylaxis after recruiting any employee, especially hepatitis B vaccine, which is provided as 016 followed by a booster dose. And immediately after any employee joins an organization, the immunization has to be given within 1 month of his joining. And about people who are working in the laboratory, it is always better to receive the tetanus vaccine. Then for those uh, healthcare professionals who are working especially in the ICUs and pediatric settings, in case if they have not been exposed to chickenpox in their lifetime, it is always better to receive varicella vaccine. So, post exposure prophylaxis refers to comprehensive management given to minimize the risk of infection following potential exposure to bloodborne pathogens like HIV, hepatitis B, or hepatitis C vaccine. The National AIDS Control Organization guidelines needs to be followed while providing the post exposure prophylaxis. Steps for managing occupational exposure. Some of the do's: remove glove if appropriate. For example, a finger has a needle stick injury. Wash the exposed site thoroughly with running water. Irrigate with water or saline if eyes or mouth have been exposed. Wash the skin with soap and water. Don'ts. Do not panic. Do not put the pricked finger inside your mouth. Do not squeeze the wound to bleed. Do not use bleach, chlorine, alcohol, betadine, or any kind of antiseptics, as they might be corrosive and make the wound deeper. So, before starting post exposure prophylaxis, it is mandatory to assess for the category of exposure. The category of exposure can be classified as mild exposure, moderate exposure, and severe exposure. Mild exposure can be defined as the mucous membrane or the non-intact skin which is being come in contact with small volume of blood. Example, a superficial wound with a low caliber needle. Then the moderate exposure. Mucous membrane or non-intact skin which has come in contact with large volume of blood. Example, a cut or a needle stick injury penetrating through the gloves. Severe exposure. Percutaneous with a large volume of blood. Example, when an accident happened with a high caliber needle such as more than 18 gauge which is visibly contaminated with blood. A deep wound which is hemorrhagic wound and it is very painful, and an accidental material that has previously been used either for intravenously or intra-arterially. So next is about the source assessment. So it is important to assess the source for the HIV status. If the source is HIV, if the source is not infected with HIV, then it is termed as HIV negative. If the source is HIV positive and clinically asymptomatic, then it is termed as low risk. If the source is HIV positive and clinically symptomatic, as per the WHO clinical staging, it is termed as high risk. And if we do not know the status of the patient, and neither the patient nor his blood is available for testing, example, an injury during medical waste management, then it can be termed as unknown. And the risk of assessment will be based upon the exposure, that is, the HIV prevalence in the locality can be considered during such circumstances. What are the important steps for managing any occupational exposure? We have 6 important steps starting from step 1 to step 6 to manage any kind of occupational exposure. The first step being the first aid or the immediate care to wash the wound and the surrounding skin with soap and water, or irrigate the exposed eye immediately with water and normal saline, and rinse mouth thoroughly with water or normal saline, or immediately refer to a physician. Especially in our hospital, you can immediately contact the CMO or the general duty medical officers. The next step is step 2, to establish the eligibility criteria for the post exposure prophylaxis. So it is very critical in order to establish the criteria immediately, because the PEP has to be initiated within 2 hours and maximum within 72 hours. We have to assess the exposed individual, assess the exposed source, and assess the type of the exposure, and later determine the risk of transmission. And based on all these, the general duty medical officer or the CMO will determine the eligibility for PEP. And if they feel the risk is high, then immediately they will advise to administer the post exposure prophylaxis. Then step 3 is counseling about administering this PEP. Provide information about HIV and post exposure prophylaxis, and obtain the consent before initiating post exposure prophylaxis, and special leave can also be offered from work. So the next step for managing occupational exposure is step 4, to prescribe PEP, assess source patients for antiretroviral status, check for pregnancy if the exposed person is a female, explain the side effects of antiretroviral therapy, and also explain the post exposure measures against hepatitis B and hepatitis C. Step 5 is about the laboratory evaluation. Provide HIV pre-test and post-test counseling. Immediately after the pre-test, it is important to test yourselves for ICTC testing. Then also check immunization status for hepatitis B, and if necessary offer HIV, hepatitis B and hepatitis C testing. Draw blood for CBC, LFT and pregnancy test whenever applicable, and also post-test counseling. Then the last step is follow-up and monitoring the adherence. It is always important for us to mark it as an incident report and maintain a record keeping. It is important to keep the results of the test confidential, but whereas it is always important to keep the records available, especially for follow-up and monitoring the adherence. It is not a one-time testing where you will test yourself and you will forget, because there is something known as window period. Hence, the follow-up testing is required at 6 months, 3 months and 6 months interval, and the record keeping has to be maintained for those follow-up testing. Then the important steps for managing occupational exposure. The informed consent and counseling for PEP is essential. Decisions on initiating post-exposure prophylaxis medications has to be taken immediately. Monitoring and follow-up for bloodborne pathogens such as HIV, hepatitis B and hepatitis C. The documentation and recording of exposure in any register, that is documenting the time, date, place, type and also the duration of exposure. So prevention and management of sharp injuries. We know that prevention is better than cure. We should never recap any needles. And also it is a good practice to never pass sharps from one person's hand to another person, and it is always safer to use the needle cutter or the hub cutter and we should always adhere to practicing the standard precautions in order to prevent any kind of injuries, especially needle stick injury. So, as a part of prevention and management, the first aid is very important. After exposure, wash the area with soap and running water. Report the exposure to the person in charge or the supervisor in charge. And after exposure, there is always a risk of being infected. Even though the risk of becoming infected is low, it is always important that all the exposures have to be reported. It should be considered as an incident report, and it is very important that once it is reported, we will be in a position to implement certain corrective and preventive aspects, and also to estimate some root cause analysis methods. So, it is very important for us never to neglect or ignore any kind of incident, even though it is at a lower risk, or even though the test report has come negative. It is always better for the betterment of the individual and also the institute to report all kinds of incidents, including the needle stick injuries. Thank you.